z okoljšnota podoba raja. Blejski grad, kjer zgodovina oživi.
Bled, imago paradisi.
together, make our own forever. Be my guilty pleasure. Your love is both mine. Am I gonna see the stars in your eyes? Are you gonna take me to the other side? Are you gonna be my summer loving, all or nothing? You hit me like a landslide. As the sun fades out, I can see clearly, and time slows down. I just want you near me. My heart beats faster, you bring me to life. As I feel your hands on my waist, my body's hypnotized. So come with me, I've got the surprise. Take you to a different space and time. Tell your dirty secrets, only love, no regrets. My heart, you can keep it
Hello. Dear friends here in Bled and dear friends all around the world, I can say. My name is Vesna Homar and I have this great privilege to welcome you all here in the 29th Janko Kersnik EURACT Bled course. What do you need to know about this course before we start? You need to know that it's about friendship. That's why we usually start the course with the words, dear friends. Because it was designed by a group of friends, for their personal friends, for the friends of teaching in family medicine, for friends in general. You also need to know that this course is a lot about teaching. You will learn a lot about how to teach. You will hear and share and experience different teaching techniques. But most of all, it's probably about how to teach and what to teach. Okay? So Bled is about what young people that are entering family medicine need to know in order to be good physicians. So each year we choose a different topic. And it's like a little bit like, fortune telling or foreseeing what is going to be relevant next year. This year's topic is about thriving in family medicine. And it was a kind of strange that last year, when we all met, the international participants and Slovenian participants, we all met in Bled. And we were thinking about this topic, how to thrive. And we couldn't really imagine how relevant this is going to be this year. We anticipated that we are going to talk about resilience, that we are going to talk about coping, that we will try to invent new methods to reach our students and residents and also co-workers. And this year, this seems to be a very, very relevant topic. When you're trying to teach something new, then usually you would just look it up, how the others do it, or maybe you would go and read some papers, some books about education in that field. But for Bled's topics, there is usually nothing in the books. There is usually nothing in the papers. So how do we learn how to teach? This is the Bled's purpose. So this course is not only about teaching, it's also about learning. And how do we learn? We learn from each other. We learn by sharing the experience that we have. We learn by creating new ways, new options, new methods. And this year, maybe the thing that we have to create together is how to be together even if we are apart. So that's why it is a big challenge this year to be together with our international friends even if we cannot physically be together. Participants in Slovenia will have to follow some rules, the rules of social distancing. We will have to wear masks on all the time. When we are inside, we will have to disinfect and wash hands, and we will have to keep physical distance. Participants online will have it easier from this way, but it will be more difficult for them to work in groups. But I'm sure that with the help of the facilitators, they will manage just as well as if they were physically present. Dear friends, at the end I hope that at the end of this course we will be able to say that we were together, even if physically we were apart. Thank you.
Thank you, Vesna. I'm Mateja Bulc. You all know me. And those online colleagues and friends, some of them know me and some will know me when we finish the course. My duty is to welcome you here. I am a GP, now retired, and I'm, along with Igor Schwab, the only doctor who was at all 29 courses. So I'm one of those who started not only the Bled course, but also the Department of Family Medicine in Ljubljana. Those were the days, my friend. No social distance and things, such a rubbish. I understand physical distance, but social distance, this term, let's say, should not be allowed in Bled course. We have to be socially close together, otherwise our race will not survive. We need each other. Patients need us, and we need patients, and we need colleagues, and so on. No social distance. So I suggest that you introduce yourself, this group first, and then we'll go to the online colleagues, okay? Nadia? And please tell me why you are coming to Bled courses.
Hello, I am Nadia Pfeiffer-Križnić. I am GP. I work in a small town near Ljubljana called Kamnik. I am a tutor for students and from residents. And why I'm coming here? Because I come here because I love this. I love this kind of work. I love to be with my colleagues from Slovenia and from abroad. And every time I feel very good here in Bled. So this year is a little different, but I think that we will survive.
We
Thank you.
definitely will. Yeah. Thank you.
I'm Tadeja. I work in a primary healthcare center in Ljubljana. I'm a tutor to students and interns for many years, and I'm addicted to Bled. So I've been coming here for 20 years, and I'm looking forward to these years too.
Thank you.
I'm Andriana Sotirova. I'm coming from Health Center Ljubljana. I'm young GP, so I'm here to learn how to be a good GP doctor.
Thank you.
Hi, I'm Ana Perdih. I'm from Ljubljana also. This is my second Bled, and I'm so glad that I can be here because last year I found out how many great people are in family medicine, and the organizers made a great topic, and I'm sure that we will when this course ends, that we will be richer in our hearts.
Thank you.
My name is Ingrid. I'm coming from Primary Care Center Krško. I'm also a GP and a tutor for students and residents. I expect that the topics today and all 3 days will be something special, like in all Bled courses. And I'm very happy to be here because of meeting all my friends, colleagues, and to speak about our problems and everything else.
Achievements.
Yes. Okay.
I'm Janus Rifel. I also come from Kamnik, but I work in even smaller village, Komenda, and a small town, Mengash, in a retired home for retired people, small home. I'm also a teacher at our department. I think it's assistant professor, but I don't know. I'm not sure if it's the right translation. Associated. Okay, associated professor. I come here, I think, 10 years already, and it's really it's the best. It's the best education program in Slovenia, I guess, in medicine. So it's really a great time, and we really learn a lot. Thanks.
I'm Danica Rutar-Pavlic. I came here because this is the best educational meeting and workshop in Europe. I'm sure that the winner of the award will also be this meeting. So there is a substantial need to come back every year to Bled. And what to add, the only thing is that I'm also working every day in my primary care practice. I'm individual contractor at Brezovica, which is the village near Ljubljana. And I'm also professor at the Department of Family Medicine. I'm also president of Slovenian Association of Family Physicians.
My dear friends here and my dear friends abroad. I'm Leopold Zodik, GP here from Bled, and I'm also manager of our primary care center here in Bled. Every year I am responsible for field work here in Bled. But this year we shall not go to the patients at home. So this year I invite two GPs from Bled, one that is working more than 30 years here in Bled, and the young one who is working only 2 years. And you will see how they manage, how they survive in our work, and this is also the aim of our course. Thank you.
Nazaj.
Hello, my name is Jean. I'm a GP trainee or a resident trainee from Ljubljana. Still, hopefully the last year I introduced myself as such. I cannot figure out whether or not that's my third or my fourth Bled course. I think it's my fourth. So it's been a while. Third, okay, third. I come here because of the sense of camaraderie and friendship that's at the same time the most intense learning experience I've ever had. So thank you all so much for all the experience up until this point, and I look forward to getting some more this year.
Hello, my name is Janko. I'm from Ptuj, eastern part of Slovenia. I have some students in my practice. I will have one trainee in November, and because he has introduced him to me, and I always learn a lot from you, and I like being with you here.
Thank you.
My name is Miriam, coming from Community Health Center of Ljubljana, working as a GP, and also I'm involved in educational process. I'm trying to come to Bled each year because topics are really very interesting, special this year, and I hope it will be connected to this new situation with viral COVID infection.
Naprej.
Hello, my name is Davorina. I work as a professor at the Department of Family Medicine in Ljubljana, and I'm also employed with a private contractor who gives me flexibility that I can also work more at the department. I love this Bled course. I need to come here because I also then run a national workshop on the same topic, but I love also to meet, of course, all my friends here. This year especially, because this physical distance is really also a social distance, which is really unpleasant. The other thing, I think this year it's amazing topic because we have to explore thriving in family medicine, and it would be a very good learning point also for other professions in the medicine.
I think that was a problem, but now I decided and I came.
Okay, welcome.
Thank you.
Darinka.
Hello to everybody. I'm Darinka Klancher. I'm coming from Cerknica. It's a small town southeast from Ljubljana. I'm working as a GP and I'm also working in nursing home, also involved in the teaching program process in the Department of Family Medicine. Why am I coming here? Because of all these great people, the best people in the world, and of course because of the topic, because I have to prepare a workshop for our tutors, but it's not the reason why I'm here.
Side effect.
Hello, I'm Simona. I work at Community Health Center at Ljubljana. It's my first time to be here for the last 10 years. I have been trying so much to join, but this year I finally managed and I'm glad. So I enjoy working with young people, with colleagues, and social distancing is the word I hate the most. So I believe we won't use it here. And I'm sure that it will be a great course because all colleagues told me that it's the greatest one.
Hello, I'm Nevinka. I'm coming from a community health center, Kamnik. I'm here in Bled many years, so I like this course because it's the best recipe to learn a lot and enjoy in the same time and be relaxed and the rest and everything together. At the end of this course, we are always richer, knowing a lot of new topics, new things, and meet a lot of friends, and it's fulfilling a lot.
Hello, my name is Eva Gorup. I come from a small town near Ljubljana, Vrhnika, where I work in the clinical center, in the small clinic, primary care, and I also work at the Department of Family Medicine as an assistant. And of course this year, it's my first year as a group leader, which means I haven't slept for the last week. I think this is my 10th year here at the Bled course, and it doesn't seem nearly enough.
Thank you.
Hi, my name is Tamara Frastefan. I'm coming from Ljubljana. I'm GP. I've been here in Bled for 19 years, I think. And since it's always very nice to come here, besides everything, and I've just gained a few pounds, in last year, a lot of gray hair. And I hope I will build up my resilience here. So
Thank you. Thank you. Now, Yonah, I will invite the members of your working group. From Portugal, I call Margarida. Are you there? Maybe Raquel? Ah. Guck mal. Mariana from Serbia? Imamo zvezo sploh. Nekaj ne štima, ne? Očitno nimamo zveze, mislim glasovne in slikovne. Just a minute for technical improvements. Okay. In grupo Yonah Yaphe working group, Margarida from Portugal, Raquel from Portugal, Mariana from Serbia, Via from Latvia, Darinka from Serbia, Dragan from North Macedonia, Sashka from North Macedonia, Alberto, Carlos, and so on, from Portugal. Paolo, hello Paolo from Ukraine, Martina from Israel, Charalampos from Greece, or maybe it's Charalampos, I'm not sure, Ivana from Ukraine. Group 2, run by Ellen and Ruth, are
Kličejo, ker to ni bilo v planu, a ne da bo zdaj že takoj povezava. In jih zdaj kliče, tako da jih bo dobil, samo da jih bo dobil, bo takoj spostavil.
Super, hvala lepa. In the group 2, Bruno from Portugal, Galia from Israel, Sara, North Macedonia, Mario, Portugal, Elisabetta, North Macedonia, Jerry from Ireland, Anna from Serbia, Albina, Ukraine, Irina, Ukraine, Maria, Greece, Vanya, Croatia, and Marta from Portugal. Well, very welcome everybody. Soon we shall get the connection online, and then you will be able to greet the Slovene participants here in Ribno. Just be patient for some moments. This year, we have 2 working groups. We always had 4 working groups, but this year, mixed. Half Slovene participants and half foreigners. At least we tried to do that. This year we have 2 Slovene groups and 2 foreign groups online. Slovene groups face-to-face, in vivo, and 2 foreign groups. And 2 foreign groups online. But anyway, I'm sure that we shall again create the Bled course atmosphere, which is well known all around Europe. And usually the people, before they depart, they say that they will definitely come next year because they have to fill their accumulators to survive to thrive till the next year. So very probably we also already made the test how to thrive in family medicine so far in these 28 years. Let's hope that we shall survive this year too with all the unusual situations that we meet. But that's family medicine, uncertainty, definitely. Yeah. Since it takes a bit too long, very probably we should start with a first lecture, which is actually greeting or introduction by Yonah Yaphe. So I hope that we have connection with Yonah. Yeah. So, yeah. Relax for 3 minutes, have coffee or juice, or even better, water. Now you have water. The participants online didn't get the bottle of water. I'm sorry, it was impossible to send them a bottle of water and Bled Cremeschnitter, the Bled well-known sweet.
We will just show it to them.
Yeah, you will be able to observe us how we eat Cremeschnitter. So let's have 3 minutes relax, and then we'll go with an introduction of Yonah Yaphe.
Sanko, moj sin danes zjutraj, ko smo se prijavili, ker sem otrokom pač se poznavljala, pa mlajši še niso čisto razumeli, pa tako pa jim je ta starejši razložil, da gre mami v šolo v naravi.
Lušten.
Čisto res. To je v bistvu to, ne, greš, se spustiš, ti spustiš.
Draženka, živijo. Zdaj smo vse skupaj, kdo dela v skupinah. Lahko se tle usedete. Draženka,
Dobro jutro.
Dobro jutro, Yonah. Just a minute. Bo? Ok.
Ja, super.
Mi se tukaj vsi tikamo.
Ja, super.
Prav? Hello, Yonah.
Dobro jutro.
Dobro jutro, Yonah.
Dobrodošli.
Thank you very much. Where? Please introduce yourself first.
Good morning to everyone. Just before we start, can you ask the host to enable screen sharing? Dobro jutro.
Screen sharing. Can you see us? Can you see us?
Yes, I'm just muting the streaming because there's a slight delay. I'm going to stick to the Zoom window. Is that correct? Okay, it's so nice to see all of you, and I'm just filled with regret that I'm not there with you. I almost hopped on a plane to come on Wednesday evening, but my better judgment and Zay convinced me that it would be, it's not wise to travel now. So, but again, I'm with you in spirit, and I agree with all the comments about the lack of social distance between us because we feel so close. I would like to just take 4 or 5 minutes to introduce the course in a more formal way. If screen sharing is working, can we permit screen sharing? Dynamic, Danny, can you permit screen sharing here?
Danny?
Or does someone have my slides, my introduction slides there that they could project on the screen?
I have.
If not, I can say it. Host has disabled screen sharing, so if not, I'll take you through.
Očitno ne štima, no?
Yes.
Yonah, do you hear me? Okay. Can you please switch off the YouTube that you have opened?
Right, okay.
This is making the disturbances.
Okay, I'll close that.
So if you have it somewhere open, so just leave the Zoom meeting open.
Right.
Okay. And now Dani will probably sort this out that we will see you again.
Screen sharing imaš omogočen.
Ni še kliknil ga.
It's okay. Told you it's about learning.
Okay, now it's working. Yes, okay.
Yeah? That's it.
I've said to everyone that I'm going to learn more than anyone else on this course. Okay, well, welcome again, and this year's Bled course is about teaching and learning about thriving in family medicine, and it's the 29th Janko Kersnik International Bled course. I've attended since the 6th course, so this makes this my 23rd course, and as everyone said, this is the high point of the year. I learned so much from this course. I enjoy so much from the social contact with everyone. And the new people here will discover this for themselves, and the veteran members will recharge their batteries. I'll start with the winner of last year's photo prize contest. And I don't know if you plan to do this again this year. Ribno would be a beautiful site, the Sava River and so on, for a photo contest. But the best photo selected by the course directors at the end of the course, we promise will be used to advertise the course next year. This is Eva's, I believe, is it not? Martha, okay, right. So the objectives of this course, and this is similar to the module that you'll create at the end of this course, by the end of this course you'll be able to list the strategies used by successful family doctors to cope with change. You'll be able to teach an approach to thriving in the profession to students and trainees, and you'll value the need for a constructive approach to change in medicine. So again, to take a step back and look at the process of this slide, for those of you who are not familiar with the Bled method, we list the knowledge, skills, and attitudes in our objectives, and these are measurable and achievable within the time frame that we have. So that's where we hope to go with this course. And the way we're going to do that is we're going to have a series of 4 keynote lectures, lots of time for work, followed by plenary discussion, lots of time for small group work with your tutors. We're going to try the technology for the international groups as well as the local groups. Poldi mentioned the field work, which is always a high point of the course. I've sent around some homework that you might want to consider expanding on when you use this in your own setting, and we've included readings for the course as well, which we'll make available to you on a website or by email. So the first keynote coming up in about 3 minutes is Ruth Kalda from Estonia, who's going to talk about thriving at work and how to make your work more meaningful. This afternoon I have the pleasure of talking to you about becoming the hero of your own story, and teaching and learning about resilience in family medicine from a personal perspective. Tomorrow, our colleague Alan Shirley from Sheffield will speak about building resilience in family medicine through a systems and teams approach in the workplace. And of course, Professor Igor Schwab will be here with his Joker session. And we have no idea what he's going to say this year, but we know that we're going to enjoy this, and we know we're going to learn from this again. Of course, your wonderful Bled course directors, Mateja, Eva, and Vesna, helped by the course organizers, Vesna, Nena, and Poldi, are always there to help make this a comfortable, pleasant, and stimulating educational experience, and feel free to contact them with any of your needs or requests. And it's amazing how much hard work they've done to make things look so easy and run so smoothly. So, hvala lepa. We've got field work as well as Polly mentioned. This is a photo done by our colleague Yossi Klein from Israel. I like this photo. It's a great photo from the lake, from the Pletnas. So again, a visit to a multi-generational family of family doctors who are going to teach you about thriving in our profession. And finally, the assessment. We'll do this on the last day when we present a teaching module that you'll be able to use at home or in your home setting. How will you teach this to others? We'll measure the success of the course by the modules that you produce, and we'll also get some personal reflection on what did you learn. And personal assessment, individual assessment is often the most powerful form of assessment there is. So just to conclude this brief introduction, we know that challenging times call for creative solutions. This year the course is going to be different because of the restrictions on travel and the need for physical distancing. None of the foreign participants will be wearing masks, so at least that's an advantage that we have, that you can see our faces, but we need to make special adaptations this year. In spite of these changes, we hope that you can cope with them and have a stimulating and enjoyable course, and we promise you this will be the best online Bled course ever. Okay, so back to you, and now I'd like to introduce Ruth Kalda from Estonia family doctor from Tartu, who will present her remarks on resilience and thriving.
Yeah, yes, please. In meantime, we all present, yeah, mismo se... Okay. Welcome, Ruth.
Okay, I understand you see me?
Yes. Yes.
And you hear me? Well,
yes.
Okay. I'm sorry. Greetings to everybody, the old friends and the new ones. Yeah, Mateja said, yeah. Sorry?
Nothing. We didn't say anything.
So, now you hear me, yes?
Yes, we do.
Okay. It's quite strange because my voice, I hear my voice a bit later than I speak, so it's really strange for me. Yeah, but I try now to share my presentation here first with video. Yeah. Do you see? Mm-hmm. Okay. Is it? Yes. Yes. Yes, yeah.
Can you please switch off the YouTube that you're still having on your computer? And
Okay.
just leave the Zoom open, okay?
Okay. Is now okay?
I think it is. I think it is. Do you still hear your echo?
No, not yet anymore.
Okay, then it's
done.
Perfect.
Yeah.
Thank you.
Okay. What about my presentation now? Do you see it? Do you see my presentation? Sorry.
Yes, we do. Yes.
Mm-hmm.
Just proceed. It's okay.
It's okay. Okay, sorry. Sorry for this. So I try to start with this. So, yeah. About thriving at work. Yes, we have to be resilient. Yeah, and yeah, it doesn't matter what kind of programs we have, technical or the clinical ones. This is our important task as a family doctors, to be resilient and find our ways to thrive at work. So I am Ruth Kalda from Estonia. My background is family physician, but I'm working at the university. My task is to lead the institute, or I'm head of the Institute of Family Medicine and Public Health. So I'm teaching, I'm working as the practical doctor, and also I make some scientific work and try to combine everything and try to be resilient and try that work as much as possible. I think that this is not only about how to teach, but this is also about the learning. So my aim is to talk about and to share about you concept of thriving, and to share the very practical steps and trickies how to promote thriving in own work, either you work in family practice or in university department. But first I would like just to understand and how many of you actually have thought about what does it mean to thrive at work. You can just show by hands, I see you in the auditory, how many you actually have been thinking about, do I thrive at work or not? And what I need, or how to achieve thriving at work? No. So to put you more close to this topic and to invite to think about that, first I ask you to read the questions here in the screen you see, and work alone, read these questions alone and try to answer all of them in 7-point scale. So 1 means that you disagree with this sentence, and 7 is that you are strongly, you strongly agree with this sentence. Do it alone. I leave you some 2-3 minutes and make a note if you would like to. Is rating those sentences. So I hope that you had enough time. So I go further, and as you probably understood, and there are actually 2 dimensions of thriving at work. And those 2 components, learning and vitality, they interact with each other, and they create this sense of moving forward or progressing at work. And it's not captured by either vitality or learning alone. And this feeling is something that I'm motivated intrinsically for self-development. This is a great feeling. Now a bit more about these 2 components. vitality, as you already mentioned, and you filled this questionnaire or this answered the sentences, it means that you feel something like that. At work I feel alive and vital, or I have energy and spirit, and I feeling energy which comes from inside of me. And this energy provides employees resources, cognitive resources to be creative at work, and also to think more broadly and accept and combine different perspectives. Be flexible. Learning. And this is something like I always find that I learn something at my work, or I see myself developing continually. I feel that I'm developing a lot because of work, and also it's feeling that I enjoy these challenges, but I meet in my work. Because I know that I learn new things and new knowledges and new skills because of these great challenges and difficult experiences. And it creates motivation to learn and develop like a person. Now a bit about how this thriving relates with surviving and resilience. Surviving just simply means that just you continue to live or exist. And sometimes it happens that people just try to survive at work. Of course, it means that it's not developing and it's not being active and creative. Resilience is defined as individual ability to adapt with life challenges, difficult situations or adverse conditions. And you are going to learn a lot about that during the next sessions. But thriving is something beyond of resilience. And in essence, it happens when we use these difficult conditions to innovate and transform ourselves. And it focuses more on this positive psychological experience of increased learning and vitality to develop oneself in the next level. But it's very important to stress that thriving can happen also without any challenges, extreme challenges, I think, here. It's not always that we need adversities and difficulties to thrive. But if difficulties and challenges happen and exist in the working place, the resilience is a prerequisite for real thriving. So first you have to practice resilience, and then you can go to the next level like thriving. Yeah, this is very familiar to you. And this is Maslow pyramid of needs. And according to this pyramid, the thriving is located on the top. Yeah, it means that all the other basic needs have to be fulfilled before you experience thriving, like as nutrition, sleeping, all the safety issues, friendly atmosphere at work, self-esteem, respect of the others, and all other important preconditions. Actually, the conceptual model of thriving at work was developed already 15 years ago. So it's not the old concept, but it's not very new one. And the first authors of this concept were Spreitzer and yeah, you see the names here in the slide, the other authors. proposed this very complex model. This is called like a social model of driving at work. And this model explains how these individual characteristics, interpersonal characteristics, we call it relational resources, and they relate to this driving at work. And also it shows how this driving is linked with positive outcomes like health, burnout, less burnout, positive attitudes like job satisfaction, and high-level task performance. And the researchers stress that driving work is not simply removing or decreasing the stress factors. They suggest that driving at work requires increasing of those positive or the favorable characteristics and contextual features at working places. So I will concentrate or focus more now on relational resources because, some people, they thrive naturally with little outside encouragement, but majority of the people, they need positive work environment and these right conditions, enabling conditions to thrive. First, I am explaining little more deep what does mean heat for relating. And this is something how effective coordinating works in a team. And initially it was described in very high risk context in such situations where small errors can lead to the catastrophe like aircraft. But the heedful relating is very important in other organizational contexts too, like in healthcare and especially in family practice, where the task interdependence and team members interdependence is very high. And heedful relating has three main facets. One is contributing or how the participants act in relation for each other. The second is subordinating. It means that how they fit to the actions of other participants. And the third one is representing of the collective work, representing of the team. How do I feel that I belong to the team? So now I move to the next one. I will skip those characteristics which are more well known, and I go to the workplace civility. To explain it, it's important to understand, and we know that the people, of course, in the working place, they come with different background, with different norms and different understanding with this, what is okay and what is not. And the key is to identify and try to correct if some troublesome behavior is happening in the working place. But unfortunately, we all know, I know, and the studies show that those incidents are not treated, they are undertreated, and often no actions will be taken. And one possible way, if some unexpected situations or the troublesome behaviors happens in the working place, is work together some code of civility. just make it as a team. And I demonstrate here one possible example. It's just part of our hospital, our university hospital code of civility. So very simple rules, very understandable rules, but it was worked out together, and we always can refer to this code if some misunderstandings happens or occur. This is easy. This thriving at work is very much influenced by the leadership behavior. So if the leaders are supportive and they are empowering the team members, the thriving at work happens more often. I go now to explain more transformational leadership, meaning of the transformational leadership, because this is quite a new concept. I think that probably described in the literature some 5 years, no more, and it is shown that especially this transformational leadership or this kind of role model leads more to thriving at work as well. So what does it mean? What kind of person is the transformational leader? First, she or he is like a role model by personal characteristics, by behavior. The other is that the leader has capabilities to encourage team members to explore new ways of thinking and doing the things, and she or he is accepting all new ideas. The transformational leader keeps all the lines of communication open so that team feels that they can share all the ideas and the feelings related to the work. But transformational leader also accepts and considers individual opinions too, not only the team, like a team opinions, but also she attends to the personals. Transformational leader has clear vision where to go and is able to communicate it to the team members and the others, and also is able to motivate the team members to fulfill these goals. I think that it's quite a new generation type of the leadership, but this is not a critics to old ones, but I think that this is like a more equal partnership in the leadership, more horizontal leadership than the vertical one. So since 2005, during 15 years, there were many studies and articles published in this issue. And I would like to stress or to highlight some very important knowledge since far. First, autonomy and self-determination is very important to drive factors to thriving. And the other important finding is that thriving is explaining more variance in burnout, subjective health, and task performance than more traditional factors like job satisfaction. I would like to go now to the health issues because this is a very important issue. First, those people who thrive, they tend to be, not only the subjectively more healthy, but also objectively they report fewer complaints. They visit doctors less, and they experience less burnout, and putting all together, and the healthcare cost of those persons is lower. But here you see also all I already explained in more scientific way. You see that thriving at work is highly relating to job satisfaction, highly relating to the health issues, and also very important in preventing burnout. And compared to the positive emotions regarding the working place or work engagement feeling, thriving at work has more influence on these issues. I would like now to talk a bit about mental health and workplace thriving, because this is another important aspect studied a lot. And this is important also because we know that people suffer more mental health than some 10, 15 years ago. WHO showed that almost 4% of the global population suffer from depressive disorder and the same amount of anxiety disorder. And the majority of the people actually who suffer of the mental diseases, they are employed, they work. And one big study of the workforce in the Europe demonstrated that at any one time range, 1 to 5 or 2 to 5 people, they experience some kind of mental health problem. And going further, European Working Conditions Survey showed that more than 1/3 of the workers, they think that their health is negatively affected by their working conditions, and that depression, stress, anxiety accounts almost 40% of all cases of work-related issues. And there are, of course, a lot of studies and guidelines of mental health and thriving at work. On one hand, it's important issue because mental health problems reduce opportunity to thrive at work. But the other side, if the working conditions and the relationships are not supportive and positive, this is the frequent reason of mental health problem and anxiety disorders. So, result of the meta-analysis demonstrate that actually there are 3 categories of factors which explain workplace mental health problems. One is imbalanced job design, the other is occupational uncertainty, and the third one is lack of the respect in the workplace. Now you ask what to do, what kind of interventions can help us. Studies show that yes, there are many prevention programs which can produce some effect in the working place. Resilience is one of them, and this is important. However, the studies stress that it's not only that we have to practice the resilience, but the same important is that we try to change this negative working atmosphere and remove these risk factors from this work environment too. Also, it was demonstrated that staff training and workshops on mental health to understand better the risk factors for the mental health and how to prevent the depression, for example. The courses about how to cope with these stressful situations can help a lot. And these courses especially which are provided in a working place. And also in that kind of professions like healthcare workers, when we meet often some traumatic experience, very difficult situations, and the routine use of debriefing is very important. And don't forget, and this is very important, regular physical activity and also provided and allowed in the working place is also very important, and the effect is abroad. So now I go to some practical aspects. First, I would like to stress that happiness is not something you can postpone the future. You can design it already today. And some practical steps. So, very important is that you can promote the culture of teamwork, the culture of collaborating, information sharing, problem solving, taking all the mistakes as learning opportunities, not criticizing. Don't forget, celebrate. For example, I, together with my team, we participated together. There were many people. We participated together in last weekend in Ironman in Tallinn. And after that, we celebrated it. And this kind of celebrations are really very important to the team. Feedback is very important. Constructive feedback and emphasizing strong features, strong points. Talk about positive stories, share values. And also, what is very important is to pay attention and talk about mental health, to recognize it very early, and you have to develop some program how to deal with people with mental health in your team. This staff who experiences poor mental health needs support. About learning, which is very important dimension of driving. Provide the team and all the members in the team opportunities to learn, for the nurses, for the doctors, for the other team members. Send them the courses, provide coaching, allow them job shadowing in the other teams, in the other family practices, in other departments, and if it's possible, to develop the system of mentoring of the new ones. Vitality is very important. Remember that you have to fulfill the basic needs first in order to be in the top of this hierarchy and in order to thrive at work. So boosting well-being is really important. And first, as I said already and mentioned, exercising, moving is very important. It's better than any other antidepressant. Organize walk and talk sessions. Create some activities, working up physical activities at work. Support, if you can, access to trainings. Sleeping is very important. We know that low sleep is associated with low job satisfaction and also low motivation, reduction in functioning, less innovative thinking, and also poor task performance. And also those people who experience a lack of sleep have troubles with the emotions. They can be and to experience some anxieties and also angry sometimes for the other people. So sleeping is very important, and we have to accept that people are different in their sleeping. Some people are owls and some are people who really enjoy very much to work at the nights. So if possible, be flexible in that. Start your day with those people who enjoy the early mornings, and if possible, to allow those people who like the sleep a bit longer at the mornings, let them work and later on. So actually, we in our family practice, we divided our tasks so that we start very early at 7 with those people who like to work in the mornings, and then the other part of the people who like more to work at the evenings, they can do that. So our practice is open quite a long day, but everybody can choose when to work. Breaks. Research revealed that people get a boost if they have additional breaks during the day. And it was found by studies that those who take a break every 90 minutes report 30% more that they are more focused on the tasks than those who take no breaks. And also the studies show that they have nearly 50% greater capacity to think creatively. Finish more work in less time. The outcome is that they finish more work in less time. They left work earlier in the evenings, and they report much less stressful overall experience during the busy seasons than those who don't take a breaks. About vacations, this is also very important. Those people who take the regular vacations and vacations which prolong more than 4 weeks, they experience more job satisfaction, engagement, likelihood to stay with the organization, and they experience more thriving at work. So allow people to take their full vacations if it's possible, because it leads to the more positive outcomes. About nutrition, the basic need. Starting from the working place, provide healthy food options rather than just snacks and drinks, sugary consisting snacks and drinks. Also, which is a very good tradition, we try to implement that we offer free foods every day in the working place, and also water, of course, mineral water. So everybody has access to the very clean mineral water. And if possible, have your own kitchen at working place. Encourage people to prepare their own breakfast or lunch. Sit together during the lunchtime. Enjoy your food. So, and putting all this together, I would like to have my final message. That also some people, yes, like to be born with resilience or thriving. Those whose resilience is lower, they can learn it, how to do that, how to cope with challenges, how to train abilities to cope, and how to flourish when the going gets tough. And you can see here some literature you can find in Amazon book about thriving at work. I think that this thriving at work is very important, not only for the leaders or the heads of the departments and the practices, but it's also very important skill, ability. I say skill and ability because you can learn it and you can learn how to make your work better. So I think that it's very useful literature to study for everybody. Also very normal family doctors too. Thank you for your attention, and I try to be on time and to save some minutes for the discussion too.
Thank you very much. Very interesting. A little bit new aspect. Do we have any comments? Okay.
We have some comments from online participants, in particular from Yonah. Both Yonah and Alan commented that leadership might be an interesting topic for a future Bled course. So everybody has
some noise here, sorry.
Can you hear me?
Okay.
Yeah?
Yes. Yeah.
So everybody can now have 3 days in which to ruminate on whether you would like to learn more about leadership on some future Bled course. Yonah wanted to make a comment on employee assistance programs, which are his clinical work now, but he said there is no way he could, there's apparently no way for the online participants to speak. So he said there are programs for online mental health assistance for employees by email. And this does sound like something that could be useful, especially in big organizations where people cannot look after each other, but also when people feel unsafe or not particularly, or do not feel that their mental health issues are can be discussed in work environment, I suppose.
So,
okay.
Do I have some questions?
I would just like to comment on the discussion about summer leave, vacation, because I think it's in our culture is very much a vacation is something that you get if you are okay, but it's not something that you need, and that we have to when I have influence to approve vacation to my colleagues and co-workers, I always say that vacation is something you need, not that you have sort of right whenever it suits the working environment and the work. So I think it's a very good point that vacation is something that you have to be able to choose when you need and you want. And it's not something that somebody else says, now it's the time and now it's not the time that you get it.
Yeah. Yes. Yeah, I agree totally. Thank you, Davorina. I think that it's one basic need. Probably we sometimes don't understand this. Yes. But we don't understand that we actually need it, but it can lead, and the studies show, and also my experience shows, that those who don't take the holidays or the vacations in the final and they are not so productive anymore. They don't enjoy the working. They have some more troubles, and of course, we cannot talk about the thriving. If we say that that we expect that people actually have to thrive at work, because it's positive feeling that I can do that. I can manage with everything. So I learn a lot. This is positive feeling, and to get it, we need to know what are our basic needs. It's not so simple that it's just here.
Yeah. Ellen asks, many of the features that promote thriving seem to be different to the dominant culture of medicine as taught in the hidden curriculum. How can we combat that?
Yeah, I know what are you talking about. Because I'm coming from this traditional, traditional teaching too, and the traditional academic university. But I can say that that these traditions are changing, and I'm very happy of that, because not only the new generation, but also accepting that the world is changing, and our needs are changing, and that culture is changing, And of course, I don't want to talk about these snowflakes or the new generation, but it comes more and more acute nowadays that we have to accept that there are the new rules, new ways of the working, and also new ways of the teaching, and accepting the other ones. So I think that is something what is our future, if not now, then the coming years. Yeah.
Thank you. Any more comments? I have a comment. This capitalistic greed for productivity, working the whole day long, having breakfast and also lunch at work, it ruins the family. You have no family life, and if you don't go to holidays, then you really don't have any family life at all. And you need that feeling that you belong somewhere, and that you have people that you can trust, and that love you and you love them. And this is diminishing every day, and this is social distance. This is the most disease-making distance ever. That's why I'm very happy that I was working only half day all my life, of course sometimes even in the afternoon at the department and so on, but not every day from the morning till the dark. No, thank you. This doesn't make a good and healthy people, neither in mind and not in the body.
Yeah.
Folk.
Yeah, agree. I was very much surprised when I some 20 years ago or 15 years ago, coming from Estonia, yes, having our own rules and understandings how to work. This understanding came from the Soviet traditions. So I visited Scandinavian countries, and I was so surprised that they really know how to work and how to enjoy the work. So like I said today, the break after each 90 minutes, lunch, then not 8 hours work, but some 6 or 7 hours work, and then go to the families, go to not having the phone calls after that. So yeah, and it's possible. And at the final end, they were more. I think that they did more than we during this full day working, because they were more effective. They solved more problems. They were relaxed and resilient, and they the task performance was in the more high level.
Because we are not machines. Another one? Yonah asks, Eva and Ruth, do you ever tell your learners to get alive?
To get alive. Yeah. Here, first we have to remind ourselves that we have to alive, yeah. If we don't do that ourselves, then it's impossible to teach somebody, I think that. So don't forget to be alive ourselves. Mm-hmm. And I always say to my team members that, yes, of course, our patients are so important. We work because of the patients' outcomes. We would like to help them. But if we don't help ourselves, don't accept ourselves, our needs, we can do that. We cannot help our patients so much.
Yeah, because you cannot understand them.
Yes.
Right. Mm. Thank you. Tatiana?
Yes, I want to stress celebrations. Celebrations at work, in the team, in family. If you celebrate some little things like birthdays, because if you think you work somewhere and some people don't have any year their birthday, they don't celebrate.
Yeah.
Even those,
Especially
even
women.
you in the team. So celebrating is quite joyful happening through the whole year, to touch to each other and to think and no, we are in the distance. So I think we should have all to think about how to celebrate in our environment every day.
You do?
Yes.
Do it.
Yeah, great. Yeah, and celebrate even the small things, minor things. So it's, yeah, try to find those things. Yeah.
Oh, Vesna, please.
I have a comment about that question. Do you ever tell your co-workers to get alive? I think we should start with the students. I think that when they come, especially in the early years, like first year, second years, they feel that they have to devote their whole life just to their studies and to medicine. And they kind of, that's what I see, that they're trying to adopt just one role, one professional role, being a medicine student. And sometimes I tell them, actually I try to tell everyone that works with me, to get alive, to get something else as well, that it is important that they're aware that they need more than just one role in their lives, because otherwise they're brought up in that traditional sense that we're just doctors and that this is the most important and that nothing else matters. Because, and this seems a very successful strategy for quite some time. Couple of years they're on the top of everything, but then they crash. And I think we should start with the students.
Yes, Vesna. It reminds me that, if I can, I would like to share the experience I have with my daughter. My daughter studies in Copenhagen. She is studying public health in Copenhagen International University. And actually, there is a rule that if you do something more, not only studying, but working or belonging to some organization or, whatever, then you can have stipendium. Not only if you just only study. Yes.
Great. So if we have no more questions, We thank you very, very much, Ruth.
Oh, thank you.
And
Yeah, it was a difficult, the situation, but I hope that we managed.
I hope that we'll manage the small group work too.
Yes.
And enjoy the afternoon and see
Thank
you
you.
tomorrow again. Thank you very much. Za nas. Kar povej, da si tle se sliši. The group work for all groups starts at 10:45. Yeah, it's written, it's in the agenda. So don't forget. Thank you and see you tomorrow.
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad, na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
regret.
Po končani karieri vrhunskega športnika me kljub napornemu delu v turizmu zanima mnogo stvari, za katere prej nisem imel časa. Bled, njegova okolica, Julijske Alpe. Zelo rad hodim. Slišal sem za pot okoli Julijskih Alp. Julijana Trail. Resnično bi rad zvedel kaj več o tem.
Pa Tomaž, živijo.
O, Martin.
Kva, začel v hribe hoditi, hodnika, kaj?
Ja, veš, da res, zdaj imam pa več časa, tako da raziskujem Bled, njegovo okolico, Julijske Alpe. A si ti slučajno slišal za pot okoli Julijskih Alp, Julijana Trail, a to kaj poznaš?
Glih to pravega si vprašal. Jaz sem sodeloval pri zasnovi, pet greva skupaj.
Ja, super, pojva, krasno. Če si vzameš čas zase, če hodiš in če pot ni naporna, lahko vidiš veliko znamenitosti, narava je krasna, ljudje so zanimivi. Po današnji etapi do gori bom naslednjič pot nadaljeval peš proti Pokljuki. Bled je res lep in kot domačin sem vesel, da ga Julijana Trail ni zaobšla.
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad, na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
smo že tle. Po končani karieri vrhunskega športnika me kljub napornemu delu v turizmu zanima mnogo stvari, za katere prej nisem imel časa. Bled, njegova okolica, Julijske Alpe. Zelo rad hodim. Slišal sem za pot okoli Julijskih Alp. Julijana Trail. Resnično bi rad zvedel kaj več o tem.
O, Tomaž, živijo.
O, Martin.
Kaj, začel v hribe hoditi, hodnika, kaj?
Ja, veš, da res, zdaj imam pa več časa, tako da raziskujem Bled, njegovo okolico, Julijske Alpe. A si ti slučajno slišal za pot okoli Julijskih Alp, Julijana Trail, a to kaj poznaš?
Glih to pravega si vprašal. Jaz sem sodeloval pri zasnovi, pejt greva skupaj.
Ja, super, pojva, krasno. Če si vzameš čas zase, če hodiš in če pot ni naporna, lahko vidiš veliko znamenitosti, narava je krasna, ljudje so zanimivi. Po današnji etapi do gori bom naslednjič pot nadaljeval peš proti Pokljuki. Bled je res lep in kot domačin sem vesel, da ga Julijana Trail ni zaobšla.
Pridite.
Hvala.
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad. Na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
smo že tle. Po končani karieri vrhunskega športnika me kljub napornemu delu v turizmu zanima mnogo stvari, za katere prej nisem imel časa. Bled, njegova okolica, Julijske Alpe. Zelo rad hodim. Slišal sem za pot okoli Julijskih Alp. Julijana Trail. Resnično bi rad zvedel kaj več o tem.
O, Tomaž, živijo.
O, Martin.
Kaj, začel v hribe hoditi, hodnika, kaj?
Ja, veš, da res. Zdaj imam pa več časa, tako da raziskujem Bled, njegovo okolico, Julijske Alpe. A si ti slučajno slišal za pot okoli Julijskih Alp, Julijana Trail? A to kaj poznaš?
Glih to pravega si vprašal. Jaz sem sodeloval pri zasnovi, pejt greva skupaj.
Ja, super, pojva, krasno. Če si vzameš čas zase, če hodiš in če pot ni naporna, lahko vidiš veliko znamenitosti, narava je krasna, ljudje so zanimivi. Po današnji etapi do gori bom naslednjič pot nadaljeval peš proti Pokljuki. Bled je res lep in kot domačin sem vesel, da ga Julijana Trail ni zaobšla.
Izvolite.
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad. Na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
Bled, Imago Paradisi.
končani karieri vrhunskega športnika me kljub napornemu delu v turizmu zanima mnogo stvari, za katere prej nisem imel časa. Bled, njegova okolica, Julijske Alpe. Zelo rad hodim. Slišal sem za pot okoli Julijskih Alp. Julijana Trail. Resnično bi rad zvedel kaj več o tem.
Pa Tomaž, živijo.
O, Martin.
Kaj, začel v hribe hoditi, hodnika, kaj?
Ja, veš, da res. Zdaj imam pa več časa, tako da raziskujem Bled, njegovo okolico, Julijske Alpe. A si ti slučajno slišal za pot okoli Julijskih Alp? Julijana Trail, a to kaj poznaš?
Glih to prav ga si vprašal. Jaz sem sodeloval pri zasnovi, pejt greva skupaj.
Ja, super, pojva, krasno. Če si vzameš čas zase, če hodiš in če pot ni naporna, lahko vidiš veliko znamenitosti, narava je krasna, ljudje so zanimivi. Po današnji etapi do gori bom naslednjič pot nadaljeval peš proti Pokljuki. Bled je res lep in kot domačin sem vesel, da ga Julijana Trail ni zaobšla.
Janko!
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad, na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
Imago Paradisi.
smo že tle!
Po končani karieri vrhunskega športnika me kljub napornemu delu v turizmu zanima mnogo stvari, za katere prej nisem imel časa. Bled, njegova okolica, Julijske Alpe. Zelo rad hodim. Slišal sem za pot okoli Julijskih Alp. Julijana Trail. Resnično bi rad zvedel kaj več o tem.
O, Tomaž, živijo!
O, Martin!
Kva, začel v hribe hoditi, hodnika, kaj?
Ja, veš, da res, zdaj imam pa več časa, tako da raziskujem Bled, njegovo okolico, Julijske Alpe. A si ti slučajno slišal za pot okoli Julijskih Alp? Julijana Trail, a to kaj poznaš?
Je glih to pravega si vprašal. Jaz sem sodeloval pri zasnovi, pejt greva skupaj.
Ja, super, pojva, krasno. Če si vzameš čas zase, če hodiš in če pot ni naporna, lahko vidiš veliko znamenitosti, narava je krasna, ljudje so zanimivi. Po današnji etapi do gori bom naslednjič pot nadaljeval peš proti Pokljuki. Bled je res lep in kot domačin sem vesel, da ga Julijana Trail ni zaobšla.
Janko!
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad, na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
Pridite na Bled, mi smo že tle! Po končani karieri vrhunskega športnika me kljub napornemu delu v turizmu zanima mnogo stvari, za katere prej nisem imel časa. Bled, njegova okolica, Julijske Alpe. Zelo rad hodim. Slišal sem za pot okoli Julijskih Alp. Julijana Trail. Resnično bi rad zvedel kaj več o tem.
O, Tomaž, živijo!
O, Martin!
Kaj, začel v hribe hoditi, hodnika, kaj?
Ja, veš, da res, zdaj imam pa več časa, tako da raziskujem Bled, njegovo okolico, Julijske Alpe. A si ti slučajno slišal za pot okoli Julijskih Alp? Julijana Trail, a to kaj poznaš?
Glih to pravega si vprašal. Jaz sem sodeloval pri zasnovi, pejt greva skupaj.
Ja, super, pojva, krasno. Če si vzameš čas zase, če hodiš in če pot ni naporna, lahko vidiš veliko znamenitosti, narava je krasna, ljudje so zanimivi. Po današnji etapi do gori bom naslednjič pot nadaljeval peš proti Pokljuki. Bled je res lep in kot domačin sem vesel, da ga Julijana Trail ni zaobšla.
Jakob! 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 Jakob!
Pridite.
Bog je človeku ustvaril deželo po rajski podobi. Imela je jezero, reke polne rib, visoke gore in skrite jame, da ga branijo pred mrzlimi vetrovi. Dal mu je ogenj, da si v njem skuje ostrico, in prostrane gozdove, da v njih poišče svoj plen. Pridne roke, da obdela plodno ravnico, kamen in les, da se zida si dom. Vrh strme skale je zrasel mogočni grad, na otoku staroslavna cerkvica. Bled, z okoljčno ta podoba raja. Blejski grad, kjer zgodovina oživi.
It's all the same, like some things never change. I couldn't stop and say no. It's all the same, but you won't take the blame, even when you are blowing up. Oh my, you're my broken love. Nobody's gonna save her now. Oh my, you're my broken love. So come on, let me show you how. Oh my, you're my broken love. Oh my, you're my broken love. It's all the same, but some things never change. I couldn't stop and say no. It's all the same, but you won't take the blame, even when you are blowing up. Oh my, you're my broken love. Nobody's gonna save her now. Oh my, you're my broken love. So come on, let me show you how.
Lahko začnemo. Okay. Se on začne.
Hello, Yonah.
Dobar dan.
Kako si?
Hvala, super, dobro. Give me another like 3 to 6 weeks and it'll be fine. How was lunch?
Very short.
Oh.
Yeah, we were working in working groups 30 minutes over. So I suppose that you can start, Yonah. We are ready, if you are ready.
We are on air and you can begin. Oh, that's what Danny told me. I have to compliment your staff in public because the technical support is excellent, really super. And so it makes our lives easier. So yeah, it's important to recognize all the people who are working hard to make this possible. Okay, well, as the introduction says, and now the man who needs no introduction. Okay, so let's share screen. And today I have the privilege of talking to you about becoming the hero of your own story. And this is the way we'll learn something about resilience in family medicine. Let me go back from stop share and just get a visual. Can you see the slides clearly on the screen? Yes? Yeah. And can you hear my voice? Yeah, and you can see my face. Well, less important, but okay, that's what I usually ask when I'm standing in the room. If I'm speaking too quickly or say things that are not clear, feel free to interrupt in chat or by waving a hand, and I'll break the screen share from time to time to maintain eye contact with you because that's important as well. So let's go back to the talk. And by the end of this session, I hope that you will be able to define for yourselves this concept of resilience. That's the cognitive or knowledge objective of this talk. I also hope that you'll know how to promote resilience in patients, in students, and in yourselves. That's the skill. And the attitude objective is that you'll value resilience as a core concept in thriving. And Ruth did an excellent job in her talk this morning about showing the hierarchy of survival, resilience, and thriving, and how resilience is necessary for thriving. So it really is a core concept. And we'll look a little bit more about that concept of resilience and see how it helps us in understanding how we got to where we are today and where possibly we can go in the future. So what are these concepts of thriving and resilience? And perhaps we'll look at some textbook definitions and then practical applications in medicine. So when I thought about resilience, I had two images that came to mind that may be familiar to you. One is the clown doll, which is inflated with air and weighted on the bottom. And some children are given this toy as a punching bag so that when they punch the toy, no matter how hard they punch it or how many times they punch it or where they throw it, because of the weighting in the bottom and the nature of the plastic and the air, it always ends up upright. So that is quite a resilient toy, even for the most active child. The other nicer example from nature is the example of living bamboo, so that it bends but does not break. And even in high winds, this material will, after the wind stops, come back to its full height and its normal height. And we speak of bamboo as a resilient material. Are we okay so far? I can see that people are sitting forward and looking at the screen and engaged. We're okay, great. Thanks, Janusz. The room is just filled with old friends, and I'm going to express my regret. My dancing partners, I see my dancing partners from Tina's dancing lessons and Foldy. I want to be two places at once. Okay, let's get back to work. Right, so these are two images of resilience in toys and in nature. And if we look at a dictionary definition, one application in sociology which is taken from nature is, for example, the capacity to recover quickly from difficulties, or a toughness. So that the British Dictionary says, we often speak about the remarkable resilience of so many British institutions. Well, we'll see how resilient they are with Brexit, but that's another issue that I won't get into. Because I'm so pro-Europe, it's ridiculous. But okay, so the ability of a substance or object to spring back into shape, elasticity. So another example from a synthetic, nylon or rubber is excellent in wearability, abrasion resistance, and resilience. So again, we speak about the chemical or physical composition of the material that allows it to be deformed, but to bounce back into shape. So then how does this apply to us in our lives, to psychology and to medicine? Well, the American Psychological Association has written a nice document for the general public on resilience that I downloaded and put in your package. We can share this on a website. And it defines it as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. That's today. Such as family and relationship problems, serious health problems, or workplace and financial stressors. So we've got this concept of adapting to stress. And the other element that they put into the definition is this idea of bouncing back. So that as much as it involves bouncing back from these difficult experiences, it can also involve profound personal growth. And we're warned by the psychologists who say that the road to resilience is likely to involve considerable emotional distress. So we don't paint a picture of rainbows and unicorns and say, oh, everything is wonderful. Yes, life is hard. Sometimes life is tough. And we do face trauma, tragedy, threats, and so on. But we have this faith or optimism that we can bounce back. And in facing adversity head on, we are likely to grow as people. So this is important for the doctor, it's important for the patient, it's important for the student. But yes, challenge and adversity are part of that process. So don't be afraid of it and don't shy away from it. Now this concept of thriving, which is in the title of our course, is familiar to all of us in medicine from our early days as medical students in pediatrics, when we learn the concept of FTT, in the abbreviation in English, failure to thrive. When we look at the growth of babies, first we learn about the normal growth charts. These are either Stewart or Tanner charts from, they could be National Health Survey charts from Boston, where they took large populations and looked at the distribution of growth within that population over time. So age is here, and height or weight or head circumference are here. And at each visit at 3, 6, 9, 12 months, whatever, we measure the baby and put the weight on the chart. And we find out which percentile they belong to, often from birth, and we see that they grow along their percentile. We say that they're thriving. These charts are particularly useful in the pathological situation if the child breaks percentiles. That is to say, they start in the 25th percentile and end up below the 3rd. And we think, well, something is wrong because ideally, based on statistics, they should be growing along this percentile. But if they break percentiles, they're failing to thrive. So for example, this child might be suffering from recurrent acute otitis media, and either antibiotic therapy or ventilating tubes or whatever the current fashion is will help this child to have some catch-up growth and get back. This might also be a child with celiac disease who is sensitive to gluten. Removal of the gluten from the diet will allow the child to reduce the inflammatory response in the gut and allow the child to grow again and thrive. So again, this concept of failure to thrive involves a personal characteristic, an external insult, and a reparative measure which allows us to thrive again. And we can apply that in our lives, in our careers, in our patients' lives as well. So again, an American definition of thriving refers in the botanical sense to flourishing or flowering. When a plant thrives, it grows vigorously and is able to produce flowers and reproduce. In an economic sense, we say that someone thrives if they gain wealth or possessions. Again, here's a good materialistic American definition, so that they're prospering when they're thriving. And we're not going to go into the material side of thriving, but I just want you to know that some people think in those terms. However, there's an interesting contrary view here that we progress toward or realize a goal
despite of or because of the circumstances we face. And that gets back to what the Psychological Association said about the role of trauma. For example, someone who thrives on conflict, a stress puppy in other words, may do well when they're faced with challenges. So that, again, they don't run away from the conflict, they don't avoid it, they don't deny it, but they may thrive because of the challenges they face. And the next little bit here is we're going to talk about heroism, but let's stop the sharing for a moment. Are there any particular comments or questions about the terms resilience or thriving at this point? Anything that needs clarification? I don't see any particularly. No, people are shaking their heads. Thanks, that's useful. Okay, so now let's get back to this concept of heroism. That's great to see the room. Thanks to the cameraman for allowing me to be present. Okay, let's get back to, okay, I've seen you all now. That's great. Oh, good. Here we are. Cheers. Okay. Okay, let's get back to this concept of heroism and why I chose to label my remarks, how can you be the hero of your own story? So again, we're going to have to define what's a hero. Now, here are three of my friends from when I was about 8 years old and living in Cleveland, Ohio, and had a friend who had a huge stack of comic books, which my mother wouldn't let me read because she thought the small print would ruin my eyes. But my friend next door had all these comic books of Superman and Batman and Spider-Man, and I bought into that story. And so these were the images of childhood heroes. But that's not the use of the word today. Again, we think about heroes who are not as dramatic as these figures in the previous slide, but perhaps these are modern heroes, the health workers on the front line in full protective gear, helping patients with COVID or suspected COVID infection. So that my definition of the hero, the modern hero, is it's the ordinary person who does what they have to do in spite of the obstacles they face. And some people do thrive in this situation. So again, I think you are a group of extraordinary people, but we'll call you ordinary people. You have a task and you do what you have to do, and there are certainly obstacles that you face. So I think that you all fit into the hero category, and you can be proud of that. And I would like to look at the hero myth or the hero story to see how this applies. Because again, you can see your patients as heroes and you can see your students as heroes. And this has a powerful therapeutic and pedagogic or educational effect. So let's keep this idea of the hero in mind as we progress in this talk. Now, my ideas come from a book that I read many years ago by Joseph Campbell, A Hero with 1,000 Faces. This book was actually lent to me by one of my best friends, my childhood friend, Dr. Michael Seabag in Montreal, who is an ophthalmologist. Actually, he's a super subspecialist. He's a retinologist. Actually, he deals with one layer of the retina, so you can't get more specialized than that. But he's a humanist, and he reads books like this because they help him to understand the person behind the eye. So that I borrowed this book from him, his recommendation, read the book, and then discovered this whole notion of the hero myth. Now, we don't use the word myth as something false. A myth is a story with a structure which recurs in different civilizations. So we'll see what Joseph Campbell tells us about the hero myth as it appears in different cultures and why this applies to medicine. Joseph Campbell, in studying many different myths, was able to flesh out or identify the hero's journey. And he put it into this popular schema which everybody can follow. And in fact, it's been put into script writing books because it's so useful. And you may recognize these steps if you know your classics from the stories of Ulysses, the Iliad and the Odyssey, or if you prefer the stories of George Lucas and Luke Skywalker and the Star Wars trilogy. What's more than a trilogy? I think there are 9 there. The Star Wars stories, you'll see this in every film along the way, that an ordinary person is suddenly called to adventure. There may be a supernatural aid or a threshold guardian who brings them from the ordinary world, the known world, into the unknown world. They cross the threshold and they face many challenges. I'm sure if you're thinking of Star Wars, if you know the films or any of the other classic hero stories, you'll recognize the steps along the way. Along the way, they're helped by various helpers and mentors. They're tempted by various sirens or other temptations. They finally meet their nemesis in the great battle, and there's a battle unto the death, which reveals something about them. They're transformed by their struggle. They may atone for previous sins or wrongdoings, and then they return to the known world and back to their old life, but they're permanently changed by this. And again, if you watch any of these dramatic movies, these historic movies, you can see the hero's journey and look at these steps along the way. But the fascinating thing is that this also applies to us in our ordinary lives, in the challenges that we face, such as illness, loss, tragedy, and so on, and the people who help us along the way, the struggle we have, and the way we grow or are changed by this approach. So it's quite a fascinating model, and the reason that this can help us, as Campbell explains to us, in a therapeutic way, is that we can help patients to turn from victims into heroes. Perhaps you know the gold sovereign coin, 20-pound gold coin from the UK, which has the Queen or King on one side and St. George killing the dragon on the other. So you tell the patient they can flip the coin. You may feel like a victim now because of the circumstances you faced, but you're actually the hero of your story. Just turn the coin over and let's find that heroism in you. As Joseph Campbell says, the passage of the mythological hero may be over ground, incidentally. Fundamentally, the voyage is inward into the depths where obscure resistances are overcome and long-lost forgotten powers are revivified to be made available for transfiguration of the world. So that each one of us has within us this untapped power. If we look inside, we can find it, and that's what helps us to overcome the challenges we face. Now, I imagine you can see how this helps you when you're facing COVID infection, how your patient can use this in facing a catastrophic illness, or how a patient recovering from childhood trauma might recognize the strength they have that have allowed them to overcome this. So the hero myth then becomes extremely important. Are we okay at this point? Are you with me? And you can back to that. Okay, see people nodding and recognize, and you know stories, you've seen the films, and someone's waving there, that's great, okay, thumbs up. You've seen the films, you've read the stories, you've got your own stories, I'm sure, with examples of heroism in them, and that perhaps in the small groups you'll be able to tap into that this afternoon when we talk about what turns you on in medicine and what excites you and what makes your profession worthwhile. So I see that everybody's awake and nobody's left the room, so I feel better already. Remind you again, drop the share screen from time to time and get back in touch with your audience. Okay, so back to PowerPoint, and we'll see the origins of this idea of heroism and thriving, and some of the key thinkers who've influenced me and my work, some of the books I've read, and some of the things I do in my everyday practice. Well, one of my heroes is Aaron Antonovsky, originally from New York and who later lived many years in Israel in Beersheba. And he developed the concept of salutogenesis, or what makes us healthy. Now, I've quoted him in previous years in Bled, and I've put him into my articles, and perhaps you know, but if you don't, refer to him again. I had the great pleasure of meeting this man before he died. Met him several years ago when he was on sabbatical in Berkeley in California, and just a lovely person and a wonderful person to get to know, and a good teacher, and his book has been hugely influential. Now, he said in medical school we study pathogenesis, or what makes us sick, and he said as doctors we should be studying salutogenesis, or what makes us or keeps us healthy. And he came to that conclusion from working with Holocaust survivors who had survived the concentration camps and the ghettos, and cancer survivors who had survived trauma of a different kind. And from his in-depth interviews and surveys, he found that what keeps us healthy is a sense of coherence. Now, this is composed of three subscales, or three components, which he called a sense of control, so that we have some control over our lives, plus a sense of rationality. There's some logic to what we're doing. We're not just like Sisyphus rolling a stone up a hill every day to have it roll down the other side. Medicine feels like that sometimes, but if we have a sense that what we're doing makes sense, that it's different, and that we have a sense of purpose, that there's a higher meaning to what we do. So when we have a sense of control over our work, you can control your working hours or the number of patients you see a day or some other elements of your work, that there's a logic to your work and that what you're doing makes sense, then everything seems to have to fit together. And in case after case, when he talked to survivors, he found the survivors who had resilience and the ones who thrived had this sense of coherence in your life. So you may want to look up Antonovsky and salutogenesis and read more about him if you're interested in doing research or interested in improving your clinical work in this direction, because it applies to your lives as well. The other philosopher who Antonovsky actually built on, who I've mentioned as well before, is Viktor Frankl, who himself was a survivor of Auschwitz, a doctor from Hungary, from Budapest, who survived, he believed, because he was a doctor and felt it was his mission to help others and help them survive. And then after the war, he devoted his life in that direction to helping others and wrote a book that's been translated. This is the Portuguese cover, in Busca de Sentido, which means man's search for meaning. It's been translated into about 70 languages. Small book, huge influence. You might want to read it and find out how that affects your life, and certainly can help the lives of patients. And Aaron Antonovsky used the ideas of Viktor Frankl as well when he talked about the sense of meaning, which helps patients to thrive. And the third philosopher who appeared in Ruth's lecture, and I warn you, he's going to appear in Alan Shirley's lecture tomorrow, is Abraham Maslow, the American psychologist who, along with Carl Rogers and others in positive psychology, looked at our needs in a very patient-centered way. He wasn't talking about pathology. He was talking about humans and what they need to survive: food, sleep, sex, and shelter. Safety needs. If bombs are falling or if the house is on fire, you have to be safe. You can't be threatened in your work by bullying or harassment. You need to feel that you belong. You have love from your family, from your team, from your group, so that you can have intimacy when you feel that you belong to a group. And finally, you derive a sense of self-esteem. You feel good about yourself because of what you do, some kind of achievement. You have some confidence in your position within your group or your status. You make the rank of professor, whatever else is important to you, and that gives you a sense of esteem. And once all these needs have been met, you can move on to what he called the pinnacle, or self-actualization, which is really becoming the best person that you can become. And this achieving the individual potential was the peak of his experience, but he said you have to make sure that people are meeting all these needs. And we're seeing people struggling at this level here, and somehow they need we need to attend to these needs first before moving on. So Maslow has been an influential thinker in our work in family medicine as well. So I left the literature review for the end because I wanted you to explore these concepts with me and so that we understand the definitions. But the literature on resilience in medicine is really quite fascinating. And I love these Bled courses because I learn so much. And you know that to teach is to learn twice. So if you have to read some of these papers and make up your own slides in Slovene or whatever language you're going to do this in, you'll enjoy this because it's really fascinating to see how many people have been focusing on this concept and how applicable it is. So what does the literature say? Well, first, I like to look at a systematic review to see someone who's done the hard work of pulling all the papers together, sifting out the ones that don't apply, and finding what the good literature, what the good research tells us about resilience. So Sisto, I believe this was published in Lithuania in Medicina in Kaunas, or Vilnius, last year, found 22 articles that look at the concept of resilience in medicine and psychology. And the amazing thing is, in these 22 articles, they found 126 definitions of the term resilience. So they had to do some hard work and sift through this and find out what is resilience. So the nice definition that they found is that it's a persistence of one's orientation towards existential purposes. Now that's a heavy sentence in English, but what it's saying is that people keep going towards the top of the pyramid, to Maslow's self-actualization, or to Frankl or Antonovsky's sense of purpose. So people realize that there's something more important than just the serum sodium or the oxygen saturation. we're here for a purpose. You don't have to be religious or believe in a deity to understand this, but there's something bigger up there, out there. And when we identify that, link into that, unite with that, and we keep going towards that, we somehow are more resilient. So that inherent in this definition of your orientation towards your purpose is the ability to overcome the difficulties that you experience in different areas of your life. You persevere. And as well, you have a good awareness of your internal coherence, and you're activating this sense of personal growth. They say some people win and some people grow. So it's not considered losing, it's an opportunity for growth. And when you recognize that you're in touch with that, you're internally coherent and you're moving towards growth, that makes you resilient. So it's nice to know that 22 different articles and 126 definitions eventually come down to this core concept of struggle as growth. So the 5 macro areas that Sisto eventually discovered in reading all these articles was that A, you have an ability to recover. The clown bounces back after being punched. There's something in the individual function that characterizes each of us. It's our work as a doctor, as a family member, as a team member, whatever, some personal functioning characteristic. We have the capacity to bounce back. As I mentioned, there's recovery and bouncing back. It's a dynamic process that happens over time. So it's not bang, one injection or a silver bullet and you're all better. Growth takes time and it's sometimes painful. And it results in a positive adaptation to life conditions. So you don't give up and you grow. And that's really nice to see this definition. We can look for this in our patients and in ourselves. So my first key message is that there are many paths to resilience, many definitions and many paths. And we're seeing this, we saw this in the small group work. Someone said people came up with so many different ideas about a good future. And that's really wonderful. And then by listening to the other person, you say, oh, I never thought of that. Well, maybe I can learn from them. And that's another nice thing about the Bled course. Well, another article I found from 2020, it's quite current, is Albert and the group in the US. And it was published in a journal I don't normally read, Anesthesia and Analgesia. And it's from a hospital department. Yes, we can learn from our hospital colleagues. We don't just have to read the family medicine literature. And it looked at the way this anesthesia department responded to the COVID crisis. And the title of the article is Battle Buddies. Now, I usually don't like to use war metaphors in talking about medicine because that's not my nature. And I don't talk about the war on cancer or other fighting disease or whatever. I prefer the growth and the educational metaphors. But this issue of the battle buddies caught my attention, and it's interesting. Now, the COVID crisis is similar to a battle situation because there's uncertainty. There's risk to personal safety. There's exposure to suffering and death among our patients. We have limited resources, and we have doubts about our ability to cope. So this, by all definitions of the word crisis, a situation that tends to overwhelm resources, is a crisis. And they compared this to battlefield conditions. So what we know about PTSD and the things that can happen to people in extreme, prolonged, stressful situations, burnout, fear, anxiety, burnout, and PTSD, we know that there are steps that we can take for early diagnosis, for treatment, and especially for prevention. So the step that was taken in this anesthesia department was something called peer support, also popularly called the battle buddy system. It's a kind of mental health support or stress inoculation in which we probe first before someone reaches the stages of burnout or post-traumatic stress to help people promote adaptive responses to stress. And I'll show you what some of the maladaptive responses to stress are that we want to avoid so that we can have adaptive responses. That's in the next slide. And it promoted these ideas of self-care, personal protection, self-compassion, making social connections, and people supporting each other. And they've had really nice results in the first 6 months of the crisis by using this battle buddy system, and I'll show you what it involves. But first, let's look at some of these adaptive and maladaptive responses to stress that you'll recognize immediately from the COVID situation. So It can be in the mind or the heart, the cognitive and emotional parts of things, the body, the physiological realm, or the interpersonal realm, which is the social realm. So we have the biopsychosocial model, again, which we use. You can imagine the spiritual realm hovering above this, but we won't go into the anesthetists were talking about that. But what they want to avoid is burnout, and what they want to promote is resilience. So, for example, in the cognitive domain, someone finds that they just can't concentrate because of stress, that they're sad and cynical and fearful and abusing drugs or alcohol to cope. But on the flip side of that, you can have sharpened perception with your fears, a sense of self-efficacy, yes, I can. You can be hopeful and optimistic and have a sense of purpose. On the physiological sense, you have people who are not sleeping, who are exhausted, who have headaches and other psychophysiological symptoms. But other people are able to rest and recuperate. They're able to relax, and they're able to maintain good self-care routines like exercise, nutrition, and sleep, and healthy social connections to avoid these maladaptive responses. And finally, in the interpersonal realm, we've seen people in the COVID crisis who withdraw, who seem, I don't know who I am anymore, or others who are disruptive and get really angry and behave in conflictual ways. Some people might dedicate themselves too much to their work at their own physical detriment, feel guilty about what they're not doing, take the troubles of the world upon their shoulders and be hyper-responsible, or just give up and lose hope. But other people may feel their sense of purpose in rising to the crisis, feel altruistic, feel compassion for others, feel compassion for themselves first, and feel that as a group we have this collective efficacy and we can infuse hope. And that's one of the purposes of this course, is to give people hope and energy. So here are the adaptive and maladaptive responses that are possible in stress. And in order to do that, one of the techniques that these anesthetists wisely used was the battle buddy system, and I'll show you that now. So they assigned people a buddy in the department. Everybody had a buddy. Nobody was left out. People could choose their own buddy if they wanted to, but then they made sure that everybody had an identified person on a list who was their buddy, and they had a schedule, compulsory time where you had to check in with your buddy. When I was at summer camp, when I was about 12 years old in Ontario in Canada, when we first went swimming in the lake, we had a buddy, and you had to swim with your buddy. And every 15 or 20 minutes, the lifeguard would call buddies, and they would have the number, and everybody had to account for their friend to make sure that you were safe. And that's the way we learned to swim when we were 12 years old. And this is the way we're going to survive COVID when we're however old we are now. Okay, so you have a weekly check-in, and what do you ask your buddy every week? What's the hardest thing for you right now? So you acknowledge your difficulty, you talk about it, you don't shy away from it, you don't deny it or avoid it. What worried you today? Let's focus on the here and now. And then you focus on the positive. What went well today? Someone in our small group today spoke about the small victories. I really like that. I wrote it down on the flip chart. What small thing did I accomplish today that makes me feel good about myself? I'm moving towards my goal. And then you expand that. You ask the battle buddy, how are things at home? Whatever your home is defined as, or whatever your context is, because you have to think outside the hospital or the clinic where your important resources are. And finally, physiologically, how's your sleep? How are you resting? You getting enough rest? Are you doing a little exercise? Are you getting up and walking, or getting out of the hospital or the clinic? And how are you eating? Are you just living on high-calorie sweets and coffee, or are you eating your 5 colors and your 5 fruits and vegetables, or whatever you believe in? So what's hardest for you? What are you worried about today? What went well today? How are things at home? And how are you dealing with your physical needs on Maslow's first level? And the fantastic thing that they found in their research, and I encourage you to read this paper if you're interested in the subject, is that they were able to prevent burnout and exhaustion, and people really felt good about having the care of a buddy, and they felt good about giving care to their buddy. So exciting paper, and the key message from this is you are not alone. Okay, that's key message 2. Because our family medicine trainees in many locations are in trouble, and we talked about this in our sessions in the past on burnout, so I don't want to dwell on burnout. It had to come up in this course somewhere, so I'll just say briefly that this is some research on burnout, but I'm going to focus on resilience in the burnout in the burnout paper. So 128 vocational trainees or residents in Australia, and only 10% of these trainees had high resilience scores. And I'll show you some of the resilience scales later because you can measure this. But the important thing to notice for this lucky 10% is that resilience was positively associated with compassion, satisfaction, and personal meaning in patient care. And thank God, these are the kind of doctors we want. We want people who care about their patients and who have satisfaction and meaning from the care of patients. So the ones with high resilience are turning out to be what I would call good doctors. And the other protective effect was resilience. Resilience protects against burnout, against stress disorders, against anxiety, against intolerance to uncertainty, concern about bad outcomes, and this concealing bad outcomes of patients and breaking bad news. So that the ones who are more resistant, again, are better doctors. I'm going to stop sharing now for a second. We'll get back to the slides, don't worry, just to see where I see people writing down notes. That's great. You all have these slides. I'm going to share them freely. Use them, publicize them, write papers on them, do whatever you like. They're yours. So just to see that you're engaged and you're with me, and okay, we're good? Great. So we'll go back to share screen. So the third key message is that our learners need help. They need help with burnout prevention. They need help with resilience. So that's why it's super important that you came to this course this year, because you have a mission to go out there. When you understand resilience and thriving, you can recognize those who need help and who need extra support in developing this capacity of resilience. How are we going to do that? Well, stay tuned because I have 3 more slides. Okay, well, it's not just our trainees who need help. Here's a paper from the United States that says that family medicine program directors, and I know you're out there because there are a few program directors in the audience in Rivno, and there are some program directors from Israel and Portugal and other countries and Latvia in my small group. So we have to take care of the program directors as well, because a paper published in Family Medicine about 1.5 years ago found that among 245 program directors, there were issues with resilience as well. Again, the positive thing about resilience in family medicine teachers is that if you have personal time for yourself, if you have a healthy work-life balance, if you're able to disconnect and go home or go on vacation and stop thinking about work, you have high resilience. And also, if you don't have a lot of financial stresses, if you have a lot of financial stresses, that decreases your resilience. Now, the problem with third world countries like the United States is that they haven't discovered social solidarity yet, or the power of socialized medicine. But as I say, they're still a third world country. They have a long way to go. And when they begin to develop and look at countries like Canada, for example, they'll understand that when you don't put the dollar as the aim of your system and you focus on other issues, you may be able to improve your healthcare system. You may be able to improve the resilience of your doctors. So many countries have healthier doctors because the system. So I'm going to turn off the political message now because politics off. Okay, so let's go to the next slide. And the message is teachers need help too. And the question is, if our teachers and students need help with their resilience, and resilience is so important, can we teach it? So happily, I found that the International Journal of Psychiatry and Medicine, also from last year, this is all recent research, and someone named Brennan in the United States who developed a course in resiliency training for family medicine residents. Now here's an exciting idea. It's not just going to Bled, which I would recommend, which helps to develop your resilience, but you can teach it in your setting. So 32 trainees were interviewed on their resilience training. And this was actually a randomized controlled trial where half had training and half didn't. And the topics they were taught about in the resilience course were time management, mindfulness, coping skills, and maintaining balance. That includes work-life balance, like get a life, as I said in my question this morning. The methods they used to teach resilience were handouts of literature, like I'm showing you now, little short presentations like mine today, and various exercises like we've learned to do in Bled over the years in breathing awareness, mindful meditation, relaxation, imagery, as Ruth taught us this morning, progressive relaxation. I would include dancing, singing, karaoke, rowing on the lake, and so on, but they didn't have that in Ohio. That's only here. These are some of the methods they used. And when they looked at resilience in the two groups, they found that they were able to reduce the risk of burnout in the short term. Now, they followed these people after 1 and 2 years and found no difference in the groups after 1 and 2 years, but unfortunately, they weren't able to continue this. So obviously, this is something that you have to work on year after year. So perhaps if they design another study with follow-up, that they'll find out that there is a significance among trainees who receive resiliency training compared to those who don't. But this is a very optimistic paper, and it also gives you some practical information with references on how you can put resilience in your program. So my fifth key message is resilience skills can be taught, and that's hopeful. Now, I mentioned all this research on resilience, so the researchers in the room are going to, how do we study resilience? Well, what's going on? How do you operationalize this? How do you quantify it? So the paper by Smith, it's a little older, but it's the one used in the recent papers I just quoted. And I think Ruth also showed something similar in her lecture. I want to compare our slides from the International Journal of Behavioral Medicine. It's called Smith's Brief Resiliency Scale, and it's really short. It's only 6 items, and you ask like from 1 to 5, totally disagree to totally agree, so it's really easy to score. Items 2, 4, and 6 are negative, so you have to reverse the score from 5 to 1. But here are the questions you ask your trainee, your patient, your colleagues, or yourself. I tend to bounce back quickly after hard times, or I have a hard time making it through stressful events, or it does not take me long to recover from a stressful event, or it is hard for me to snap back when something bad happens. And I usually come through difficult times with little trouble, and I tend to take a long time to take over setbacks in my life. So again, this has Sisto's concepts of bouncing back, coping with stress, the time it takes, my emotional responses, and my self-perception. So it seems to make sense. It's got face validity, construct validity. This looks like a reasonable scale. It's been validated. You might want to translate it into your local language and try it out with your trainees and use it for discussion, if not for intervention research, where then you train people to increase their resiliency. I'm very excited by this. Maybe I'll assign it to one of my students in the university to do their master's thesis next year. That would be a great idea. Thanks for that. Okay, so resilience can be assessed. That's the key message here. And finally, again, not just teaching resilience, we need to promote this concept, and that's my final question to you. How do we promote resilience? And again, I'm going to go back to the American Psychological Association article that I suggest for you, the APA 2020 article. We need to look again in a biopsychosocial way in helping people to build meaningful social connections. So you're not alone. So when, as staff, as students, as patients, we have meaningful social networks, we are more resilient. We need to, in the physical domain, foster wellness, nutrition, sleep, exercise, all the important things we know that keep the body running, body and mind and soul running, need to be fostered. On the existential level, this was once the role of the priest, the rabbi, the imam, or the other, the guru, the spiritual leader, to find purpose, but we can all do this on our own in these secular times. We need to focus on the existential dimension to help people find meaning and purpose in their life. And as Ruth showed us in the first exercise very nicely, we can focus on the cognitive domain as well. When we think healthy thoughts, we think positive thoughts, embrace healthy thoughts, we are promoting resilience in a fourth important domain. The fifth item here in promoting resilience is something that we need to think about for ourselves. If you need help, ask for it. Seek help if you need it. We need to reassure our patients, our trainees, our colleagues, and ourselves that it's okay to ask for help. Asking for help is actually a sign of strength. And when you're able to ask for and accept help, then that's part of your resilience. So I think this is a nice, simple summary of ways that we can promote resilience among our target audiences. So the seventh message is resilience can be promoted. So again, say what you're going to say, then say it, then say what you said. That's the teaching technique. So I hope I can pound this message into you, sort of push it across. Like, there are many paths to resilience. You are not alone. Our learners need help. Our teachers need help too. Resilience skills can be taught. Resilience can be assessed, and resilience can be promoted. So I encourage you to look at the literature and don't believe anything I say. I would say, show me the evidence. So look at the evidence yourself. I'm going to take advantage of the 2 minutes I have left in my talk and this powerful forum I have from as the lecturer here to do something that I couldn't imagine myself doing in the past, but that's promoting my own book. But since this is the only book I've ever written and it's just been finished, and it's actually relevant to the topic of the course, with your permission, I'll engage in a little self-promotion like they do on television and talk shows, and suggest that you might be interested, if you want to read more, on a book that's coming out in November in the UK, Routledge Publishers, called Applications of a Psychospiritual Model in the Helping Professions, written with my colleague Cedric Spear, who's the therapist who got me involved in electronic counseling or e-counseling online. And it kind of summarizes the things that I've been saying over the past 23 years in Bled. So if you know me and you've heard some of my spiel, as they call it in German or Yiddish, in these lectures or small groups, you'll find it summarized in this book. And it refers to the healing professions, and I believe that family medicine belongs to that. And it's a philosophy that Cedric has labeled interview guidance. So it's about this self-reflective or insight-oriented kind of guidance that we give to people. And don't be afraid of this word spiritual. Again, it doesn't refer to any religion, but it's more the existential dimension, in my view, that things talking about meaning and purpose and how that applies to psychology and physiology and what we do. So just to give you a brief idea, the 7 chapters in the book, we review what went on in psychology and psychiatry over the last 150 years, where it was mostly about pathology. It was about mental illness and not mental health. And that's created some problems. So we need to broaden our horizons from, let's say, Freud and stuff that was done 150 years ago to more modern approaches like Maslow and Antonovsky and Viktor Frankl, who I mentioned today. In the 2nd chapter, we talk about talking about freeing persons rather than treating problems. Again, so much of medicine is pathologizing, and the concept of the whole person, as Ian McWhinney talked about in London, Ontario, is key to us. So we can talk about person-centered medicine rather than treating problems. The Life in the Bigger Story is a chapter that talks about the hero's journey. So there's a bit more on Joseph Campbell and how we show people how they're heroes and how we connect them to a bigger story. And if you're interested in that, this chapter with references might be useful to you. Cedric has produced a nice map for navigating personhood. He calls it the 4-fold map, and north, south, east, and west are things like the ego and the psyche and the soul and so on, so that you can use that map to navigate as you're working with yourselves or with a patient. He's got a new approach to the clinical process that he describes as the Matryoshka method, and we describe that as Matryoshka dolls are those Russian dolls which are nesting dolls, so that inside the bigger doll is a smaller doll until you come down to a perfect little doll in the middle, and maybe you can imagine that as the soul. That's the perfect person who's inside all of you, who's built all these layers, and that's part of your resilience and thriving as well, getting in touch with who you really are. The final chapter talks about what happens when we're with the patient in the office or online or on the telephone or in video chat or writing letters to each other, that we make a healing bond with the patient and how we get attuned with the patient and use ourselves, the doctor is the drug, as Michael Ballant said, to help our patients heal. So that's looked at in that chapter. The 7th chapter is just eight of our friends who are using this method, family doctors, psychotherapists, counselors, marital counselors, yoga therapists, there's a yoga therapist in the group as well, who are using this method and have applied it and talk about how they use it in their practice. And that might be of interest to you too, to see how these some seemingly esoteric ideas actually have a very practical, solid ground basis. And that's the end of the commercial plug. So my final remark now to end this hour is that resilience and thriving are valid concepts in family medicine. I believe that they can be studied and taught and researched as well, and that they're of value to our patients, to our learners, and to you. That's all I have to say about resilience and thriving. I'm very happy to answer questions if anyone has chatted with Eva, and I hope that you continue to enjoy exploring these concepts in the course.
Thank you, Yonah. Wonderful. Now we are waiting for questions.
Hello, Yonah. Thank you for a wonderful lecture. Had a sublime time, as always. I wanted to ask you a question, or even better, a commentary of resilience being a finite source, because on one hand, you speak of it in sort of a like snowballing effect of what doesn't kill you makes you stronger, or that like the diversity builds character. But on the other hand, there must be a breaking point even for the most resilient of us. So it's just like the density of the bad things happening, or whether or not like flattening the curve, being spread over time makes you stronger, or how do you look at this? Thank you.
Yeah, I accept what you're saying, because we have seen people who have been broken by life circumstances, and that's very sad to see. But we retain hope that when someone comes to us for help, a student comes to us to learn, or a patient comes to us for help, they've got strengths and qualities, and we're going to tap into those, get in touch with those to help them develop those qualities so that they can overcome whatever it is they're facing now, whether it's passing their final year exam in family medicine or coping with a chronic life-threatening disease. The image that I use from nature, you say, is it a finite source, is of a well, a deep well with sweet water. And sometimes you have to dig down very deep, but you never really know how deep that well is, but you keep going and you'll find that the life-giving water is there. And our patients amaze us every time we see how much they're able to put up with. I get these letters sometimes from patients that are 5,000 words long, 10 word pages, and they're writing problem after problem that they've coped from childhood to adult life. And my only comment is, wow, it must have taken a lot of strength to cope with. I'm amazed. You're an amazing person. You're a hero. And so let's find out what that strength is that's allowed you to survive all these things and use it to allow you to have the life that you want. So somehow, yeah, it is finite in some people because some people break, but in other people, it just seems infinite.
Thank you, Yonah, for your excellent presentation. I have two questions. First is, do you think that desire to be a hero is culturally sensitive characteristic, or is it a universal, deep human wish?
I believe that the desire not to be a hero is a universal wish. And in the hero story, Campbell specifies that most people don't want to go on that dangerous mission to find the ring or whatever it is they're looking for. We just want to get on with our ordinary lives and deal with whatever we're dealing with now. But somehow we're forced to follow that call and to deal with it. So we think that people who want to be heroes are kind of foolhardy, or they're just, someone said a hero it's not courage, it's foolishness. And that people show courage. But I think you'll find out most often that people are unwilling heroes. And what was the second question?
Yes, our professional work is a long distance run. Mm-hmm. And I think that some young doctors are not aware of this distance. And how would you teach them not to push too much on the first part of run? Because some of them are burned out before so-called finale. How would you teach them that this run is very long and that they have to have some reserve for the end?
That's a wonderful question, and I think let's write an article down. It's on the long distance running in family medicine. That's your idea, so you're first author. But it's a great image. There are some good runners like Ruth in the room. I think Ruth Kalda online who could answer that question. Well, maybe we'll ask her in the small group. And there's some good runners in the room here. I know I used to run, but my hip doesn't allow me to run now, but I used to run 10K races. I think that's something you have to learn from experience yourself. I mean, a coach can tell you many things, but until you feel it physically yourself and emotionally and then cognitively, and you see the answer is in your question. It's a long distance. You have to pace yourself, but you have to recognize when you're getting exhausted from doing too much touring. Is there a runner in the room who can answer that? How do you pace yourself when you're on a long run? How do you learn that? Yes, please.
I'm not that long runner myself. My utmost range is 20 kilometers, so I'm not that much of a long runner. But basically, when you start, especially when you start the race with everybody else, and the music is pounding, and the adrenaline is high, and you fly over the starting line, and you go much too fast, and you have to consciously stop yourself, go slow, even if that means that everybody runs in front of you. Professor Schwab would know, because we often run together in Ljubljana Marathon, and we all start from the back, and sometimes we're among the last in the race. But then you see that people who started fast start slowing down, while you who kept checking your watch and kept checking your step and go, and even though you feel that you could like run the race in record time, you start to gain after a while, and that is a perfect metaphor, really good metaphor.
Beautiful, Eva. How do you tell that to a first-year trainee who's trying too hard?
You tell them to go running 10-kilometer race.
Okay.
Several times, not just once.
Right.
Yeah. And get out of the bed the next morning. That's very important
Right.
too.
Because the body knows, and we can't separate the mind and the body and the spirit and so on and the other important things. And you have to listen to it. But sometimes you just have to experience it to know. Okay.
Yes,
other runners who can tell how you answer that?
Hello, Yonah. Very nice to see you.
Lovely, Dobrena.
Yeah, thank you for your very, very nice lecture. I have another a little bit provocative question. We are discussing this resilience now, and we know that some of our co-workers are very resilient, and you can put more and more work on their shoulders, and they will do everything. So we have to ask them not run so fast, it's long distance, and so on. But then we have the opposite. We have a non-resilient colleagues, and they do something and they're already tired, and then those resilient have to work more and more, and the tension comes because people are comparing themselves and they say, well, I'm working 2 times more and she is just tired all the time. How can we manage this situation with non-resilient people when we are at work, at profession, and we have people who actually have to contribute because we have realistic work to do. There are patients in line.
I would love to ask another runner. You have a young runner who has the potential to run a 3-hour marathon, but they're doing it in 4 or 5 hours. They're just not living up to their potential. They're being, I don't know, lazy or afraid. So what do you tell a really talented runner, and then what do you tell a talented trainee in first year who's not living up to their potential of seeing patients or learning what they learn? Can someone answer that for me?
I'm not running.
No.
Well, I guess with the trainee it's fine because we have to expect from them to be slow runner. This needs to be taken into account. But at some point we lose our patience, maybe we don't give them justice. That's why I'm asking this, although I don't know if there is any perfect answer to that, because we are just different.
It's a wonderful question, and I begin, like Janice's question, it's a very deep well, and people are not living up to their potential on Maslow's pyramid, somehow need to get in touch with that strength. Sometimes they need a push, they need a personal example. We need to see if there are lower level issues, problems at home with family, conflicts from childhood, conflicts with parents or partner, physical illness, psychological illness, cognitive difficulty. We've talked about making the diagnosis in the learner. But if you find someone who's not living up to their full potential, we need to find ways to help to make that diagnosis and to help the learner live up to what they can do. Great questions.
Alan asks,
yes.
you did touch on heroes being ordinary people, but are there more risk to the use of hero narratives? What about good enough?
Fantastic, yes. Donald Winnicott was the British pediatrician and psychiatrist, psychopediatrician, who coined the term the good enough mother or the good enough parent. When parents would come in with this horrible anxiety, oh, I'm a terrible mother or father, and then I'm this and that. And he would look at the growth chart and look at the Sheridan, whatever, psychosocial and psychomotor development, say, you know what, you're good enough. This baby is perfect, growing and achieving. And so stop beating yourself up. That's probably the voice of a parent somewhere in the head. You're good enough, and good enough is good enough. And so that's great. So the idea of using a hero as superhuman, we don't focus on the image of Superman with the cape and the muscles. We focus on the image of Clark Kent with the glasses, the newspaper, his alter ego, that it's the common person. So we don't want to make people feel guilty with the image of why aren't you like Spider-Man or Superman? Well, those are fictional characters. We don't want to compare. Comparison is a way to achieve unhappiness as well. You are who you are, and be yourself. Nobody else is qualified.
Great, thank you. And one more from Talagami. Can you please give us your personal experience of resilience?
That's wonderful. Poldi, ena pivo, prosim.
Eno pivo, prosim. Nimamo.
No, that's the kind of thing that I would do over a temno pivo at the end of the day. But I'll leave my personal stories of resilience. Thank you for the question. That's wonderful. In chapter 7 of the book, I actually put in a little personal autobiography, and you can read the chapter and find out how I've dealt with it. Every day is a challenge, but it's so worthwhile. Sometimes getting up is hard, getting up on time, a couple of hours early to give a lecture, but it's so worthwhile when you get there. Today is a story of resilience.
Ellen also asks, could small group work with peer referencing help?
Absolutely. The Ballant movement is
of course.
Yes, the Ballant movement has been incredibly empowering for family doctors, so that a doctor and a psychiatrist who are sensitive and allow people to talk freely and to have those forbidden conversations, talk about their fears and weaknesses and failures and so on, and which are actually learning opportunities and develop insight. Trainees do this as well with less clinical experience, but it's important as well. So that, and we've seen from Bled itself, why is Bled so addictive is because we get so much from the small group interaction. We were having a chat at the lunch break, and we really miss the international mix because some of the country specifics are so extreme in terms of the challenges that are challenges people are facing. I say we don't compare. We say, hey, it's not so bad here. Maybe we're better off than we thought when we hear other people's stories. But yes, definitely the answer, Alan, is yes.
Thank you. I think that we learned a lot. Thank you very much, Yonah. And we'll proceed on your instructions in our working groups now. Thank you
Great.
very much, and enjoy working group.
Thank you again for the invitation. It's always a pleasure, Mateja. Thank you.
Thank you. To je to.
Jaz bi vas, če dovolite, samo